So, hello everyone. I want to welcome you to the TMCC Dental Hygiene Information Night. You are going to be getting a lot of good information. My name is Lori McDonald. I am the director of the program. So you're here, of course, for information. This is more about the program and what a dental hygienist, what they do, what our responsibility is. So, of course, as a hygienist, it's a professional. We're professionals, licensed members of the dental care team. We use our knowledge and our clinical skills to provide that direct patient care. And of course, we know that the interprofessional skills are very important to have, right, to help motivate your patients with their oral health care and getting them to that optimal oral health. So skills needed to be a dental hygienist. You've got to have good manual dexterity and that good hand-eye coordination. We want you to have good communication skills, just kind of like how Megan said. That's why we recommend Communications 113 or higher, where you're having to speak in front of people, because you will be speaking a lot in the classes. You know, you'll be pairing up with partners, even individually, to present on presentations of certain topics. So we've got to make sure that you feel comfortable doing that. So that definitely helps. Also, you've got to be a team player, right? Because we know being a team player, that's what's going to help bring that success for everyone. And then also sensitive to diverse cultural backgrounds. So job description duties: perform oral cancer screenings. We also examine the periodontal gum, bone, and structure around the supporting teeth. We expose and develop and interpret radiographs. We also design and implement treatment plans for our patients. We provide dental health and nutritional education for individuals. In fact, we find that with those students who have nutrition degrees or who are in the nutrition program, there's a lot of these overlaps. And I'm going to talk a little bit about that and a little bit about interprofessionalism and how the hygiene profession overlaps with so many of these other professions, right? Even like the profession of nursing, cardiology, because we're finding that with the hygiene profession, if you have any kind of periodontal disease, gum disease going on, if you have any kind of heart issues or a weak heart, that these two, the bacteria and what's going on in the heart, those two can actually exacerbate each other. And so we know the importance of hygiene and being able to keep the bacterial load in the mouth at a minimal level to be able to help a patient get back to that health. So that we find a lot of these crossovers with hygiene and many other professions. Also, we remove the deposits from the teeth above and below the gum line by scaling, root planing, and polishing. So of course what we're removing below or above the gum line is calculus. But what is the layman's term? What do you know calculus to be? Plaque is the soft. What is the hard calcified? When plaque is actually calcified, what do you, like when you buy toothpaste, what does it always say that we're trying to remove? Tartar control, right? We want to control that tartar. So plaque, of course, is the soft stuff. When you wake up in the morning and your teeth feel kind of fuzzy, that's plaque. But then if it continues to sit there and it's not brushed off, then the calcium deposits in your saliva actually hook to the soft plaque and turn it to that hard deposit, which is called tartar or calculus. And that's why we need to get in there and remove it, because once it calcifies, it's not going to come off with a toothbrush. All right, we also get the chance to administer local anesthetic. Who's had dental local anesthetic? Yes? Okay, can somebody tell me, was it a good thing? Did you have a good experience? What? Yes?
No, not really.
No, see, that's what we hear, right? Did anyone have a good experience with the dental local anesthetic? You raised your hand.
She specifically asked for none of it when she got her dental cleaning.
Okay, so this is why I bring this up, because as you all know, dental anesthetic, I mean, who wants to get shots, right? But our second semester, our students learn how to administer dental anesthetic. They actually learn on each other. Don't let that freak you out. This has always been a class that students are like, oh my gosh, I can't do it. But you know what? After the first couple weeks, they are fine. And our ratio of faculty to students, I mean, it's like one student at a time to a dentist or a dental hygienist observing you. So they've all made it through. All of our students have made it through. But that's why it's so important to have that compassion and to be able to administer anesthetic in a safe manner, but to also do it slowly. Because if you really push that anesthetic in, what does it do? It hurts, it burns, right? It's a kind of a big burning sensation. So you've got to take time, and you have to be patient. And that is what makes a good clinician, and that is what we try to teach, okay? Also, applying topical fluoride treatments and placing dental sealants. How many of you have had dental sealants put on your teeth? All right, does anyone know what they are? Can somebody tell me what a sealant is?
It's like kind of like a liquid plastic, I guess you could say. Like
Say it a little louder.
Liquid plastic, I guess you could say. It just goes in the cracks and seals them, so you don't
Yes.
get cavities.
Very good. So it goes on as a liquid, right? And it's for these back molars where these deep grooves are, and that's where all of the bacteria, right? The bacteria, I mean, they're microscopic. And they love to get down into these grooves, and one toothbrush bristle on your toothbrush head will not get down into that groove, one little bristle. So that's why we will take the liquid sealant, and then we take an ultraviolet light, and we hit that for about 30 seconds. The light shines on that, and it hardens it to this nice plastic. So what it does, it then allows right here these bacteria to slide off and not to be able to get into those deep grooves. So there's so much about the dental hygiene profession, you know, from the beginning to end of this 2-year education, and it really is exciting. So employment opportunities, this actually is Lon Q. He's one of our faculty. He teaches head and neck anatomy and anesthesia. And he was actually our TMCC representative here a few years ago. So what is great with hygiene is you can work full-time or part-time. You can also work in many kind of different practices. So general practice, right, which is your private practice if you have a dentist and you go see your dentist and your hygienist every 6 months. Also, you can work as a public health consumer advocate, where you're working in hospitals, nursing homes, schools, public health clinics. And then, of course, you can also get into teaching and administration. And what's nice now with this bachelor's degree, because our program used to be an associate's degree, and now we are graduating our 3rd class with a bachelor's degree. Basically, this bachelor's degree opens up more doors of opportunities. So most of our graduates, they like to go out, and once they graduate, they start going into private practice to scale the teeth and to be able to work with a dentist. But then after so many years, if they want to go into teaching or research, being a legislative advocate, any of this, these doors open for that, okay? Any questions on that? All right. So another great thing, and I just actually added this for this information night. We have our legislative session going on right now in Carson City. And of course, you know, our legislative session to get these laws passed within our state occurs every 2 years. So what is so awesome with our profession is that now, back in 2021, the dental therapist bill, which was SB 366, passed. And so what this is doing is increasing our scope of practice to be able to work more independently. So what is great is that, you know, we do have a lot of rural areas here in Nevada, and there's not a lot of access to care for dental. Very hard for people to be able to get that dental care. So with this new bill and this new dental therapist position, it is now broadening the scope to allow us to go care for these patients out in the rural areas more independently. So we do work under a dentist, but the dentist doesn't have to be right there in the office as we're in there working. They could be in Reno, And we actually could be somewhere in Elko or wherever and working under the dentist through teledentistry. So this is something new that has just come about, and I'm looking forward to seeing where that's going to take us. Any questions on that? And you can see right now we have 5 programs currently in the U.S., 3 in Minnesota, 1 in Alaska, and 1 in Washington. So in order to do this, you have to have a bachelor's degree in dental hygiene, and this is another benefit of why we are a bachelor's degree program. And then you can apply to any of these schools here, and we're getting more schools coming about in the United States with this dental therapy education. And then once you apply and go through the 2-year program, then you're able to be a dental therapist, which is kind of like a physician assistant or nurse practitioner when you're comparing nurses to dental hygiene. Okay? All right, so just some quick facts. I was looking more for the 2023, but the most current right now is 2021. So median pay for hygiene is around $81,000 a year. It can go up to $100,000 or over. And then, of course, here it says the mean hourly wage is $39. I know right now that the majority of our graduates, when they graduate, they are making about $50 an hour. So that is, if you're working 5 days a week, that's up over.
Carson, they're hiring for starting $45 an hour.
There you go. Exactly. So 45 to 50, this is a little bit low, but this is kind of that mean average around the country. And then as far as jobs, you can see here that was in 2021, 214,000. So it's a continual growth. And I will say the outlook here between 2021 and 31, 9% faster than the average. And it is because the hygiene profession, it is such a flexible profession as far as being able to work full-time. You can work 6 days a week. You can work 1 day a week. And now with us being this bachelor's degree, like I said, I mean, you can work for state programs like Nevada. They have several positions open for hygienists with bachelor's degree, and getting in with a state, right, and being able to develop oral hygiene and health plans for schools around Nevada, and just going into all of the different elementary schools. There's just a lot of really great avenues that you can take with that degree. All right, so as far as examination and licensure, all states require that hygienists be licensed. So after you graduate from our accredited program, you do then have to pass a written dental hygiene national board exam. And our seniors just found out today that they all passed theirs. So I will say we have got a really great track record with all of our graduates in the past passing. It is a great program. So this exam is a written board exam. It's about a 6-hour exam, and it tests all of the candidates on all of the dental hygiene material and content that they learned in their 2 years in the program. Then once you pass that, then you've got to pass a clinical board exam. What is so great is 2 years ago, we here at TMCC became an actual regional testing site. So our graduates used to have to travel and go to California, New Mexico, Oregon, Washington, Idaho to take this clinical board exam. And when they did that, they would have to also take a patient, right? Because part of the clinical exam is for them to administer anesthesia, excuse me, and be able to then clean the patient's teeth, and then being able to actually make sure that they are, efficient and proficient in their skills. So what's great is now our students, our graduates, get to test this clinical exam right here in their own clinic. And we also open it up to other candidates coming from out of state that are moving to Nevada that need to take this. And the other thing now that has also changed is, for years, this is going to be the first year we're doing this, a patient, live patient, was what the candidates had to pass this test on. Now it is actually a mannequin. And that is what they are pushing for across the United States. And we are finding that it's more difficult to find those good qualified patients that don't have high blood pressure. They had to have specific amount of tartar or calculus. They had to have certain levels of bone disease, periodontal disease. And so now having this mannequin, it kind of makes it a more level playing field. And this is what part of our lobbying as hygienists and trying to move towards a scope, because if you think about it, most other professions, if you graduate from an accredited program and you get a degree, many times you don't have to do any other tests. You go out and get a job. Sometimes you may have to take a national board, but as far as taking a clinical exam, dentistry is one of the last ones that still has to take all of this to be able to show competency and to get licensed in all of these states. So it's really exciting to be able to see how we are moving as this dental hygiene profession to kind of more of this autonomous type of exam, and to be able to utilize mannequins and be able to have it a more level playing field. So that's been exciting. And then of course the Nevada Dental Practice Act, that requires the candidates to be of good moral character and citizens, and I'll talk about that here in just a minute. So for the prospective students, you do have to have a current healthcare provider CPR card. Now what we do, when you apply and you get into the program, your first class will be starting in the summer. Okay, it starts actually the end of July. And what we did is we pulled this class out. It's basically the foundations of dental hygiene. And so it's a nice way, it's a 3-week course, so it's a short course for you to be able to kind of get to know your other classmates and to be able to kind of see what this foundation of dental hygiene is, because a lot of the topics and content in this class is what then you will be learning on more specifically in all your other classes the next 4 semesters. So with a CPR card, we will schedule with the new class that comes in an actual CPR class for everybody, all at one time. So then you're all receiving your card and you're all moving through the program then, you know, so it doesn't expire halfway through the program. Also be free from health conditions which put others at risk. What they're talking about here is like, say, TB or hepatitis, which are those very infectious, contagious diseases, right? And so they just want to make sure with that, that you're good and healthy. And then the be advised part on this felony or misdemeanor conviction, they're saying that with this, if you have a history of any of this, it could stop you from being able to get a license even after you graduated from the program. But this is something, because I have had some of our students and graduates that have had some misdemeanors in the past. And I ended up calling our Nevada State Board of Dental Examiners just to find out, and they said that they have never ever stopped anybody from, you know, they've never given anybody, you know, said, okay, you're not getting a license because of this. Normally what they will do is they'll maybe ask what the misdemeanor was or the felony, and if they see that you have, what have you done to remediate yourself, then that is where, you know, they want to see that you're kind of on that right path going. But they said they've never stopped anybody from getting a license because of that. So that's good to know. All right, so preparation for dental hygiene school. You want to contact several, right, dental hygiene programs for admissions criteria. Here in Nevada, we only have 2 schools. We have us here in Reno, and then we have College of Southern Nevada down in Las Vegas. Now, of course, there are other schools in California. The closest one would be in Sacramento, Sac City. But then, of course, you're paying out-of-state fees if you are a Nevada resident, right? You also want to, in high school, take chemistry and biology, algebra, and then in college, the same thing. I will say, in high school, I did not do well in any of my science courses. In fact, I got D's because I really didn't care about it. It was when I really found this passion of hygiene when I was working as a dental assistant in a dental office that I really realized this is what I want. So if I can do it, you can do it, okay? Also visiting college academic advisors like Megan, and then talking to your dental hygienist, okay? Any questions on this? Okay. So some things to think about. The dental hygiene profession is demanding on your body. And a couple years ago, we had a couple students who made it just through the first semester, and it was because one of them, when she was young, had a horse riding accident, and she thought she was fine. I mean, she was completely healed, and it was like 15 years later. But what she found is that by sitting in clinic and learning about the way that we sit, which we talk about ergonomics from day one, because when you're sitting, working on patients, doing this very tedious work, it really has a lot of demands on your neck, shoulders, and your hands. So if you do have any kind of physical issues with any of these areas, you do want to rethink if this would be the right profession for you. And I don't want to deter you from it, but you know, when you're in there working for 8 hours, sometimes 10, working with these patients, it is demanding on the body, so you want to make sure that everything is good and healthy. I've had a couple applicants who did apply, and then they called me because they just wanted to make sure that it wasn't going to be anything that was going to cause them to not get in. And I said, no, because we don't ask any of this on the application, but you've got to make sure that you're able to endure that and able to work in that ergonomically correct position, okay? Any questions on that? All right, so this is just a picture. Thought I'd kind of add this in. This is our radiology viewing lab, and these are some of our students here viewing x-rays. The majority of the x-rays we have our students take are digital. We have moved away now from the traditional, right, the ones that they put in your mouth that just poke you in the bottom of the mouth and hit you there on your palate. And so the digital x-rays are what we have our students take, and it's nice because you can take it and the x-ray comes up immediately, so you can see if you need to retake it or if it's good to go. So it really is nice without having to run into the processing room and waiting 10 minutes for the x-ray to come out and find out you've got to retake the film. All right, so just briefly looking at the requirements. This right here is what Megan kind of was showing you earlier. So I'm not really going to talk much about this. You can see you've got to complete all of the English, fine arts, all of these categories here, right, in your Psychology 101. And then, of course, we've got your diversity. With the diversity, the one thing you're going to learn with advising is that if you there's several courses, we call them these double dip classes, and Theater 210 is one of them. I know that, you know that, huh? And so there's these courses, and so you need to talk to your advisor about these double dip classes. So if you take Theater 210 or one of these double dip courses, let's say you get an A in it. That class actually, right here, like I was saying, this Theater 210, that class will count for fine arts and diversity. So you don't have to take 2 classes, you can take 1, and we'll give you the A for both of them. And it's a way for you to be able to save some money and to be able to not have to take so many classes. So that's kind of nice. So make sure you talk to them about that. So once you get into the program, these are more program requirements. Here's all the biology and the chemistry and all of these classes that you need to take before you apply to the program. Does anyone have any questions on that? Okay. All right. And then the science prereq courses, and this is very important. So this has to do with COVID times. So these online labs in biology 223, 224, 251, or Chem 220, if they were taken in the spring of 2020, summer 2020, fall 2020, and spring 21, we will accept these courses if they were not taken in person and they were taken online. Because we know you did not have an option at that point, right? Because none of us were here, okay? The online labs for these courses from the semesters prior to spring 2020 and after 21 will not be accepted. So right now, we will accept any of these science courses, the lectures, if you take them online. We will accept that. But the labs have to be here in person. Because those labs, that's taking that concept and theory in your lecture courses and applying it in these labs. And with dental hygiene, I mean that hand-eye coordination and all of that is really what is a big part of our profession. So that's why the lecture courses are fine online, but the labs all have to be in person, okay? I also have this statement noted on our TMCC website, the hygiene website, and if you have any questions about it, you can ask Megan, or you can also email me, okay? All right. Also, the DH program will not accept an S for any science courses. So a lot of times courses will transfer in. If you took, like, say, sometimes an advanced placement class, for those science courses, we will not accept the advanced placement. Now, if you've taken math, English, some of these advanced placement, absolutely, we will accept those. And we're seeing more and more of these advanced placements coming in from high school, okay? Any questions there? All right. So this shows our clinic. 4 years ago, we got a new clinic remodel. It was almost $1 million. And we got all new units and chairs and the lights in the ceiling. We have computers at every unit, because most of our documentation and all of that is all electronic, right? Moving into the modern times here. So it's very nice, it's very comfortable for the students working-wise, and then it's exactly what you would see out in private practice when you get out there. Do I need to talk any more about the withdrawals? Does everybody understand with the withdrawals? So, you know, as far as the science, you can take it once, and you can withdraw, and you can take a science course one more time, but that's it, okay? Now, I did want to say, Megan had mentioned, because this is how it is with nursing, that science courses, that 5-year minimum, and then you've got to retake. I have had some candidates, and they're like, oh my gosh, my anatomy class, it's been 6.5 years. And do I have to retake it? And I will tell you, if they got an A in it, I will not make them retake it. So that 5-year minimum, it's not a hard policy. If you do fall into that situation with these science courses, and it's been 6 years, 6.5, email me, because then we can kind of talk about it. And if you did well in the class, and you're doing good with your other courses and your points, then I'm not going to make you retake it, okay? All right. So the application process, as she noted, the 2.75, but you really want to get higher, right, to really be in there. The pre-admission testing, talked about the HESI. The HESI test can be taken 3 times total, okay? 3 times total forever. And then the spatial relation and dexterity tests, 2 times total, okay? And then you can see these are just kind of going back to what Megan had talked about with the different categories where you can get your points and build those points up. The 32 hours for full-time and the 12 to 31 for the part-time, and then your degrees. And like I said, if you have 2 degrees, we will take the highest degree. So a bachelor's degree is worth 3, and an associate's degree is worth the 1. So these are these other categories she talked about. And then here, of course, this just breaks down the HESI test categories, and you can see what they are: A and P, biology, grammar, reading comprehension, vocabulary and general knowledge, and critical thinking. And we do not have any chemistry on this, because you don't have to be a great chemist to be a great hygienist, all right? So what I recommend with the HESI, that you are close to being completed with your science courses, because as you can see, we've got anatomy, physiology, and biology. Well, you need to have those courses pretty much almost completed to be able to take this test and to know that knowledge and to do well in those categories. This is our point system, as far as being able to get points and how you score. This point system actually follows what our scoring system is in the program. So we set the standard a little bit higher. So a C actually is a 75 and above. A B is 80, a C is 75 to 84, a B is 85 to 91, and then an A is the 92 and up. So you can see we kind of step that up a little bit more. And so that is what we follow with all of our courses. So once you get in the hygiene program, you have to get a 75 or higher in your hygiene courses to go on to the next semester. And we do that, and it's worked out really well, because once you get through the program and you're taking the national board exam, the written exam, and the clinical exam, if you go and look at our website at all of the past graduates and how many have passed the exam, it's 100% pass rate. And so this program, I'm telling you, it's why we set that standard a little bit higher. So when you take it and you're ready to graduate, you are set, you're confident, and you're going to be great hygienists, okay? All right. Here, like I said, spatial relation tests, 2 times total. They're about 30 minutes in length, and they're 35 questions long on that spatial relation. And basically what that is, it will show you, for instance, a box, a picture of a box, and then it'll show you 4 categories, A, B, C, and D, with other boxes that are laid out, and they want to see what one actually folds up to look like this box here. So it's that spatial relation 3D testing that we're wanting to see, because when you are working below the gum line on all of these teeth surfaces with all of their grooves and anatomical anatomy that's going on, you've got to be able to see that in your mind and to be able to clean these roots of the teeth without causing trauma and ripping the periodontal fibers away from the teeth and causing trauma to the gum, right? So that's why we're looking at all of this also. And then also the dexterity test, that is a pegboard, where then they test you on your right hand by putting a metal post in all of these holes, and how fast you can do that. How many of these holes can you complete that post in, and then you take your left hand and then you do both hands together. Now I will tell you, we have had many students that have gotten into the program who maybe scored well in several of the categories in the HESI, but they did not score and get any points in the spatial relation or the dexterity test. Or maybe it was vice versa. That is okay. We're not going to look at that, and if you did not score points and you got a 0, we're not going to not accept you because of that, okay? Why I actually added this several years ago is because it was more for students who maybe didn't have as high of a GPA. Maybe they had like a 3.0, right, compared to those who maybe had a 3.5, 3.75. This was just another way to be able to have that level playing field of allowing candidates to have another way to be able to build points to get in, because we all learn differently, and we all will take these tests and test in our own different way, right, and be able to get a different result. So that is why this really has been implemented, just to make it a more level playing field. And then, like Megan said, the DH HESI, you want to make sure that that is the one that you are actually applying for, and you want to apply when you're almost done with your science courses. Any questions here? Okay, so the application process, basically admission to TMCC does not imply that you're guaranteed, right, to the DH program. You do have to apply to be a student of TMCC, but then you've got to apply to the dental hygiene program. So these are the dates. You can take a picture of this. Applications will be available for 2024, right, for the class of 2025. January 5th, 2024, that's when it will be ready to go online, to where you can then get it, download it, and look at it. Applications will be due February 9th, so we give you a little over a month to get that application and everything in. And then we have application night, which I would recommend that if you are applying, you come, because I will tell you there have been, and we just now finished all the applications for this new incoming cohort, and there were a couple that did not come to application night, and they ended up not getting everything in, and guess what? Now they're exempt from that. Yeah, and what we did do this year is we did create a checklist, because there are quite a few documents that you have to upload. You have to upload your HESI results, your spatial relation, all of that. And so basically, you know, we want to make sure that everything is in there. So that checklist is going to help you to check off, to know that everything is uploaded in that file and in there. Any questions on this? Yes.
Where is that checklist located?
It is on the website, and if you go to application, like applying, and you click on that tab to the right and scroll down, you will see it. It actually, you know what, right now it probably is closed. So I'll make a note of that, but we actually can then get that reopened up, because you actually just kind of brought to my mind that, yeah, it would be good to have that checklist, you know, even if you're not applying until next year, just to make sure you're kind of going down the line. Okay, good. All righty. And then anything else on this as far as the dates? Yes.
One of your previous slides, it said 3 months experience in a dental office.
Yes.
Is that 3 months leading up to the application, or like historically?
Yes, the work experience to get those points has to be done before you apply.
So is it like say if I worked in a dental office for 2 years and I don't work in one anymore?
You're fine. This is the thing though, if you can show proof, so you would have to take that document, have it signed by the dental office, the doctor that you worked for, noting that it was either full-time or part-time. And yeah, I mean, we even had a student that was accepted. It'd been 15 years since she worked. And so she was able to get the doctor to sign it and do that. So no, absolutely.
Do you recommend working in a dental office beforehand? Like, is it like better just to get all of like the different, like, just prepare you for the program?
You know, there's pros and cons too, because we have some of our students who have had several years working in an office, and then they come in and they've maybe learned some old habits, right? Because we know out there, she's smiling back there. Because you know, it's kind of like out there golfing, right? If you don't ever really get those golf lessons, you get these swings going. And so we always say that the faculty, we're like, you know, it's good to a point, but then you can pick up some of these habits where then when you come into our program, we're having to retrain you in certain ways. And yet, it's nice to be able to see, you know, what a dental office, what it looks like, and being able to see what the dental assistant, you know, and the doctor's doing, and handing off, you know, the patient information to the front office. And so there's pros and cons to both, okay? All right. All right, so this right here basically just shows our first year semester. And as I said, this is the Foundations of Hygiene. This starts late summer, end of July, goes for 3 weeks, okay? And it goes from 8 to 12. So if you have to work, if you're working, then you can at least go to work, you know, from 1 o'clock on, okay? And I know Valerie Lambert from Financial Aid, she was talking about, well, you know, not too many of the students work. Well, I will tell you that has changed. I've been here 15 years, and when I first started, most of our hygiene students did not work. But now, it's a different story, and most of them do work. And I have had some that have worked, I don't know how they did it. I mean, it was during the weekends and nights, because normally the weekends you're working on projects and all of that, but all of them work, all of them do. And you know, some maybe will work on the weekend, or like I said, in the evening, but it's just where we are now, right? Because you've got to pay your bills. Yeah, okay. All right, so basically with the first year, you can see there are more lecture courses, head and neck anatomy, and then our dental hygiene theory class, which this class goes along with our clinical course. So the concepts and theories are learned in 304, and then you have 8 hours a week in pre-clinic, where you are then learning about all the instruments and what teeth they actually apply to, what surfaces they apply to, and that is where you start testing with these instruments, and we start you off on a typodont. That's a fake mouth. And the gums, everything really feels very real. You're able to get in there an instrument, and we have you then test on this typodont. It's part of your kit when you come into the program. And once you pass the instruments on the typodont, then you go on and you are working on your classmates. And then you have to pass your test on actually a person, right? Then after the first semester pre-clinic, second semester, then you are treating patients. So right now, our first year students, they've been treating patients for 10 weeks now. So we get you kind of in the, in the hot seat, if you will, right away, because that is where you need to build those skills. And then as you move into your second year, you're seeing then more difficult patients that have periodontal disease, systemic conditions, right, heart conditions, thyroid conditions, because with these patients with gum disease, many of them then, if they've got those deep pockets in gum disease, you're going to need to administer anesthesia and or nitrous. And then you've got to make sure that whatever medical conditions they have, whether it's diabetes, thyroid disease, or what have you, administering that anesthesia, what kind are you going to give them that's going to be safe, that's not going to cause them to go into a cardiac arrest or for the diabetes to increase, and there's a lot of things in play here. So that is where those more difficult patients during your second year, that's when we'll have you see them. Then that first year, it's more kind of, we call them Calc 2 patients, which is just more easier patients, calculus-wise, tartar-wise, and systemic conditions are more mild. So the first semester definitely is more, you can see radiology, interpretation. Skills lab, this is a lab that you go to every other week to just work on your skills in a non-clinic environment, so it's not stressful. You can get in there, you can work on your classmates, you can work on your typodont to continue to perfect your skills. So you are proficient and a good clinician when you're treating your patients. And then spring semester, we have oral path, the clinical dental hygiene 1, and then periodontic principles. You start learning then about more advanced instrumentation to use on your more difficult patients that you'll be seeing in your second year. Pain and anxiety control, that's the anesthesia course. And then your research methods. We had to implement research methodology because we are a bachelor's degree now. You've got to have that research methods, and that is why you now are required in your prereq courses to take either Statistics 152 or the Public Health 281, which is a biostats in public health class, okay? And then we've also got the skills lab during that semester. Then as we move into second year, the clinic session time increases. So then your second year, you are now up to 16 hours a week in clinic. So we have 4 clinic sessions. Every clinic session lasts for 4 hours. And so this is where then we start kind of minimizing your lecture courses, and now you're getting real heavy into the clinical to build up your skill level to treat these more advanced patients so you can get out, pass your test, and be a good hygienist, okay? So you can see all of these courses that we have here. This interprofessional class, I talked about this earlier. This is a class that I teach, and now going into a bachelor's degree, it has been great because we have room now in our curriculum to add this. And like I said, there are many, many professions where we have crossover. And so right now, for instance, our students in this interprofessional class, we have some of them that actually go to Community Health Alliance, but instead of on the dental side, they're on the medical side. So they are observing a medical doctor with well child checks. So these young children, because Community Health Alliance treats children, and so when these children come in for well child checks, many of them don't have a dentist. They don't have a dental home. The parents are not real educated on it. And so it's neat to be able to now have the hygiene students in there and being able to then give their information and to educate these patients who are being seen for a medical appointment, but now we're taking and integrating dental into that, because that's how we are finding that we can get to more people to help talk to them about rampant decay, which is caused from, right, baby bottle, we call it baby bottle caries, or just different foods and things that are going to cause that. So it really, that collaborative practice, it's a great class. And that's just one of the rotations. I will save the others for when you're in the program, okay? All right. So the estimated program cost for the 2 years is about $30,000. And let me tell you, I know that is a lot of money, but for a bachelor's degree, it's not bad. And if you look at other programs that are private, in California, they've got many of them, and there are some programs for their bachelor's degree, they're charging $80,000 to $120,000 for a 2-year degree, bachelor's degree. So this really is good. These are all of your different things that are going, tuition, textbooks, scrubs, all of this. The loops, these are those glasses with the microscope, and we require these when you get into the program. We do have a contract, excuse me, with a loop rep, Q Optics, and so she comes, she talks to you about them. You get to pick your frame, your color, and be able to then pick exactly what you want. You get the student cost, which saves you quite a few hundreds of dollars on that. But it's great because these loops are what help you to be able to keep your ergonomics so you're not bending over after 7 hours and trying to see that calculus or tartar on those teeth, right? So it helps be able to keep you healthy with your back and your shoulders and your neck. And so it is all of these here then that add up to that $30,000. Any questions here? Yes.
So does it provide health insurance, like with it, because this is like health insurance on the list, so like do you get health insurance through the program?
You do not get health insurance through the program. You do have to have your own, but we do have some good resources that during our orientation, so when you apply and you get into the program, we always have a new student orientation, and everybody has to come. If you get into the program and you don't come, then you forfeit your spot, because there's a lot of information that day. And so we will give you good resources and information for insurance that's inexpensive that you can get while you're here. Yes?
Are the clinicals held here in the lab?
Say it again?
Are the clinicals held here in the lab?
Yes, yes. Everything is right up here on the 4th floor.
So you're not going out to like dental offices or anything?
Yeah. Well, the thing is, Community Health Alliance is another place. Like I said, and not being on the medical side, it's on the dental side. And so yes, students do go out and they do still clean teeth in other rotations. Okay? All right, differential tuition. This is $88.25 extra once you get into the program. That is charged onto your regular tuition and registration fee. Why we have differential tuition, and the majority of the allied health programs do, is because in order for us to stay accredited, and especially like for hygiene and nursing, our faculty ratios, we have 5 students to 1 faculty member, and that's to keep us accredited and to make sure that we have got not 20 students with 1 faculty member trying to get educated. Okay, so it really is worth it because, like I said, now you are getting that bachelor's degree. Other ways to reduce these program costs, we've got the WUI, which is a Western Undergraduate Exchange. So if you are coming from any of these other states, you actually can get reduced registration and tuition fees. Okay, so with that, what you want to do, and if you want to take a picture of this, you do want to contact A&R, and this is the number right here, to be able to find out more information on that, on how you can save money. Okay? Any questions on this? All right. So here are some students. They're just in the clinic working. She's actually performing oral hygiene instruction with our disclosing solution right there. And that's part of our educational tool for patients to be able to see exactly where their plaque is and where they're doing well brushing and where they need more help, more assistance. All right. And this is right here, we're wrapping things up. I appreciate y'all being here. I know that we're ready to wrap this whole thing here. This is our class of 2020, and they were the ones that were hit the hardest with COVID. So, the thing is, it took a long while for these courses and for the face-to-face classes to come back. We only took 5 weeks off and we were back in because we had to get them graduated. So we were out of here the middle of March and we were back in the beginning of May. And so we ended up front loading all of the courses, lecture courses. And then as the COVID kind of started decreasing and we ended up buying more equipment and everything to keep the faculty, the students, and all of our patients safe. This was the class that went through it. But they graduated a couple months later, but they graduated in July instead of May. So that was pretty good during that time. So you can see they're smiling. They're very happy. And there they all were with their masks. They thought that would be a good one to have on their pinning program. So that's a class of 2021. This was when we could not have regular graduation, so we did the drive-by. So that's the motorhome that they drove through graduation with. Yeah. And then this was our last class last year. So we had one guy, wasn't he the lucky guy in there with all the gals? He looks pretty happy, doesn't he? All right. So here's my information. Also, all of this information is on the back of the fact sheet, along with everybody that spoke tonight, their emails and their information. Does anyone have any questions at all? What? You haven't said anything tonight.
For licensing to become a dental hygienist, is that carried from state to state or from Nevada and I got to go to Wisconsin?
It actually, that is what we're trying to do now. Part of the Western Regional Exam Board, the REB that I talked about, the clinical exam that we are now a host for, they now have combined now with the Commission of Dental Association to start pushing all of this exam, because we used to have the Western Regional and then we had the Eastern. And so if somebody came from the East or the West, they would have to retake it. So this is where we're trying to kind of get this transport going, where if you've graduated from an accredited program and you've passed these boards, then you can go anywhere. So there really is a lot of potential. There's a lot of good information moving forward for.
So right now it's like West Coast, you have to stay on West Coast?
Well, it is still like that, but they're slowly working towards it. Good question though.
Does the dental hygiene have like a state board?
Yes, we have the Nevada State Board of Dental Examiners, and they're down in Vegas. But for hygiene, we have our national association. It's the American Dental Hygiene Association. And then here in Nevada, we have the Nevada Dental Hygiene Association. So that's great. You what?
It's fascinating because they get to practice on each other.
Right, exactly. Yeah. All right, any other questions? Yes.
Earlier in one of the slides it said 14 to 16 students. Has the class size increased recently?
Yes, we are looking at taking 16 this time. And I've been approved, so with CODA, who's our accrediting organization, they are the ones that tell us I can't even accept one extra student without them saying okay. And we actually just had our accreditation a month ago. It comes every 7 years, and we got 100%. So I started crying. I couldn't help myself because it was a year of hard work and a 2,200-page manual to show them that we are complying with the standards and we're really a good program. So that was great. So, okay, what was your question? See, I was getting so excited over this whole thing, you know. So yes, so with the 16, we are looking at taking that this fall. Basically, it depends also on the workforce need. Right now, there is a huge need. Hygienists are in demand. I get emails every day with dentists saying, oh my gosh, you gotta take more because we need hygienists. So we are looking at taking 16. We've been approved for 20 from CODA, but we just purchased a brand new dental software program because we ran out of room on the other one. And it's a program that all of our students document on, that all of our electronic x-rays and all the information is on. So now it's cloud-based, so we can add as many. So that is what we are looking at, 16, and we could go to 20. It's just gonna depend if that workforce need continues, which I think it's gonna, because Reno is growing. A lot of people are coming here because it's such a great place. Yeah. Who had another question?
So that biology class you're talking about for the COVID years,
Yeah.
you said that you weren't accepting the online biology class, right?
Well, for those years that I noted, what was it, spring of 2020 through spring and fall of 2020 and spring of 2021, I will accept any of the science courses online, lab and lectures. But
If I sign up for one that's all online, you won't be accepted. I have to do the lab in person.
you have to do the lab in person. Yeah. So, good question. Any others?
Is that just for the 200 biology classes? Like would 190L, like you want-
So the 190, you have to take 190, right, to get into 223, 224 anatomy physiology. We don't look at 190. We don't even enter that into any of the GPA.
So if I get like a C.
We don't count it. You just need that C to get on into 223, 224. Okay? No, that's good. That's good. Yes.
So I'm currently at LTCC.
Okay.
So then I was wondering for that U.S. Nevada Constitution class, is there any on top of your head that would be like that could probably be like substitution?
There are quite a few. So did you already take the 2 credit one? Did you take a 2 or because I have some students coming in that have like taken say 2 courses. Normally the U.S. Nevada Constitution, it's a 3 credit class all in one, but I have some coming in that have taken like a portion and it's been 2 credit and then the other portion has been 1. So you know what I'd do? I'd get a hold of Megan and then she can look to see what you could take. Okay? Yeah, good question.